everybody. It's Karen Anderson here with Aortic Hope. Sorry, we are running a few minutes late. That's my fault. I ran into some traffic. Sounds good. I am here tonight with Amy Wagner, and she has been with us before. But for those of you that are new, Amy will tell you a little bit about herself. And the format for this evening is we're just going to talk a little bit about PTSD and trauma and what happens to the brain when you've had health-related incidents. Talk about anxiety. How can you tell the difference between the two? And if there's any caregivers with us tonight, we're going to talk a little bit about that and what it's like taking care of those of us that have aortic disease. And if we have people that are with us that have experienced any type of grief-related issues, we'll be more than happy to speak about that as well. And if not, we'll just move on to answering questions. So I think what we'll do first is just kind of jump into this, and then I'm just going to throw out some topics, and then we'll take all of your questions at the end. And if anybody watching wants to remain anonymous when asking their question, please send a direct message to Aortic Hope, and I will read it. I've got it on my phone. We'll pull it up, and we'll answer your questions. So, hi.
Hello.
Nice to have you here.
Thank you for having me again.
So great, I know.
Appreciate
Didn't
it.
I just see you recently?
Yeah.
I did. I'm a patient, so no shame in the game. But so why don't you tell everybody a little bit about yourself and what you do, and then we'll get into the thick of it.
My name again is Amy Wagner, and I have actually been in the field of social work for 30 years this month, and have been doing private practice, probably 20 some of that. And one of the areas that I do specialize is in trauma. So that's how I met Karen, is working with her with traumatic type of events. And yeah, I'm in full-time private practice right now. So that's where I'm at.
And one of the things that led me to you, and I just had a conversation with somebody online about this earlier. There's a big difference between just doing CBT and doing specialized therapy for someone who might have PTSD. So before we get to that, how can somebody how can someone determine when they've had either a very scary diagnosis or they've had a dissection, and you now know what that is, you've heard this long enough. How can somebody determine if some of the symptoms they're experiencing is just anxiety, or if it is true PTSD? Or should they leave that to someone like you to make that diagnosis for them?
Well, we definitely can. I mean, you definitely look at the criteria that's listed like in our psychological manuals, but anxiety tends to be an overall ongoing problem of nervousness, worry, an overall sense of just jitters or dread, that sort of thing. An anxiety disorder is something that seems to be present with someone for most of their life, where PTSD is a type of anxiety. So when you have anxiety as your broad heading, and you have generalized anxiety, phobias, just things of that nature, PTSD is a type of anxiety. And PTSD is not something that everybody necessarily has dealt with their whole life unless they had an early childhood event that occurred. But PTSD begins when someone experiences a event that is out of the ordinary of normal life events.
And what would be some of the symptoms, something someone would experience if they were having PTSD?
With PTSD, what happens is when you've been presented with a traumatic event, something that came along just unexpected, and what it does is, in order for you to cope with what is happening to you, because the intensity of it is so high that our brains, in order to cope with that situation, either puts us in a fight, flight, or freeze mode. And so in order to have your brain be able to figure out, okay, what do I need to do next? It uses shock to try to help us be able to cope at that moment. And once the traumatic effects of it kind of sink in and your brain begins to try to process it, some of the things are processed, but other parts of that traumatic event can get stuck in certain parts of our brain. And once they get stuck or embedded and we just can't work it through, that's when we can begin to have like flashbacks, things that trigger us to have a constant memory about the traumatic event. But you can get help for PTSD and have it processed through and be able to then move on with your life. Anxiety is more of an overall personality thing. You're an anxious type of person. Now, somebody can be an anxious type of personality and still also experience a traumatic event. So you could have both there as well. But anxiety disorders, just to generalize, are going to require a different type of therapy approach than, and I know those of you that have listened to me before, I use a technique called eye movement desensitization and reprocessing as far as working traumatic memories through.
So when I first came to see you, I was probably always somewhat a little bit of an anxious person.
Mm-hmm.
Can you tell? Yeah. But not with any huge abnormal amount, but I already had a chronic illness and I managed just fine. Then when this happened, I started experiencing nightmares, very specific water drowning nightmares, very specific type of nightmares. And then we had to go through the whole ambulance, and I'm still dealing with certain
Which were your triggers.
The sounds
were the triggers.
Smells were triggers. I started having flashbacks, and then. But sometimes there are people who have only been diagnosed with an aneurysm, and they start having all of the what ifs, and I don't know
anxiety.
Okay, so that is good to let people know the difference. So when you are diagnosed with having something that could be potentially life-threatening, it is potentially life-threatening, even though your chances of having a catastrophic event are significantly lower. And you're going through all of the what ifs and the scenarios, and maybe you're not sleeping. That's not necessarily PTSD.
Right.
Unless, of course, you had another physical issue and now it's triggering something from the past.
I mean, hearing a diagnosis can be somewhat difficult, and depending on the person, it can be traumatic. But I think it just then creates anxiety. Okay, what's the next step? What's my life going to be like? It's all of those questioning that just keeps building the anxiety up. PTSD, for example, from getting that diagnosis would be you get triggered every time you go into that doctor's office. Something sets off another memory of hearing that again. That is the PTSD.
Okay.
So that it's worry is not trauma. Worry is just a natural response sometimes to a situation or who you are just as a person. But you can learn to manage worry and general anxiety.
Right, because what ifs do you no good? And some of those,
it's what ifs, the should haves,
irrational.
all that, just perpetuate and build the anxiety up.
So what would be some of the things that, so some of the different therapies would be cognitive behavioral therapy, which is that just otherwise known as more talk therapy?
Talk therapy.
Talking through it. And then you do, as you mentioned, the EMDR. Can you explain what that, because when you first sold me on that, because I thought it was a bunch of hocus pocus, and when you explained to me everything that I need you to explain to them about the downloading of the brain being a computer and all the different scenarios, I will tell you personally, I tried it. And I will tell you what, we probably had the bulk of it taken care of within 6 to 8 sessions.
If that, yeah.
If that. I mean, now I'm going for tune-ups and we got to talk about some other things, but the bulk of my staying up and all of that got resolved.
You may have like stray little things that come along and you just work those out. But yeah, the main event, so to speak, I feel like we work through. And just simply, the EMDR is just a technique to help kind of unplug where that traumatic event got embedded in your psyche and move it out of there and into the normal filing system that your brain uses to file memories so that you don't keep having the triggers, the flashbacks, and it separates the emotional emotional response you had from the event as well. So you'll be able to think about the event as if, it's any other thing, and you won't feel that intense emotion about it. So that
it is me, and different therapists do it different ways. So and so the way you explained it to me is it's kind of like being awake in a REM state. And in a REM state, the eyes go back and forth, which is the processing moment. So you obviously aren't going to fall asleep in here.
No, you're awake like we are right now.
But your eyes are closed, and you did it where you had paddles in my hands.
Yes. I mean, it was taught to me, having someone watch your finger back and forth. Anything to get your, what they call bilateral brain stimulation. You're just moving from one side of your brain to the other. So if I just did a click, 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 that's moving your brain from one side to the other. Some people use the finger back and forth. They've come up with some other little devices like the handhelds or a light bar or things like that to be more even, but also after a while your arm can start to get tired. So they just came out with other things that do the same thing. You can tap each knee at a time, and that's the same thing. But it's kind of a guided way to help somebody work through the traumatic memory that they had. And then also change any negative beliefs that you had about yourself from that event. Because from every traumatic event, we come away believing something negative about ourselves or others in that situation. That, I am afraid, or I'm weak, or I'm this or that. And we use that technique to change those negative beliefs.
Well, and that's so true, because I think my takeaway after my dissection was that I felt it was one of the most vulnerable moments I had ever been in my entire life. And long story short, after all of this therapy, what I realized is I was probably as empowered as I could have ever been, because I passed the baton to my husband, and I basically, in my mind, just shut it down so that everybody else could do what they needed to do. So I just changed the script. I flipped the script and the narrative and realized I did everything I was supposed to do and could do. And no, I wasn't vulnerable. I laid myself down and I let them go to work, and they saved my life. So it was a lot of work though to not see it so scary.
I noticed someone mentioned here that their psychologist explained that PTSD is a normal reaction to, just an abnormal situation, event, and that's very true. It's how our brain naturally responds to something that it has never had to deal with before, or it's something totally new. And how we process it depends a lot on, too, the age at which it happened, our coping skills at the time, our support systems. But we all are vulnerable to PTSD. I mean, that we just never know what's going to come our way that may affect us that way. But not everybody has an anxiety disorder. So
and also
separate things.
And don't take for granted that your loved ones who sat there in that horrendous waiting room for the 6 to 12 hours, however long you were all in there waiting, that didn't create some PTSD for them too.
That's called secondary traumatization, and your family members or whoever experienced this with you, it's important that they be given an opportunity kind of talk that out as well, and talk with you about it, or if they feel like they can't talk with you personally, that they seek out some counseling for themselves, just to kind of walk it through. It may not be that they need extended counseling, but also to try to diffuse the effects of that secondary trauma.
Because the new normal is spread across the board. We've had this new normal, I know us as survivors hate this term, but there's been a new normal created for our friends. If you go back to work, your coworkers, your family, they have new normals because they have to deal with us differently now too. And what I realized is my guilt of creating that worry in them. I don't know which is worse, their guilt in planning my funeral and then I survived, or their guilt thinking, oh, it's just her stomach, it's nothing big, and then realizing it was potentially catastrophic. So there's but every feeling is normal.
But it is, and just like for their own health, if they start feeling a pain or certain thing or something in their neck or whatever, it might make them more anxious, wondering, okay,
Is this going to happen
is this
to
going to
me?
happen to me? Is this what this is? And so it's important for the whole healing process that everybody try to be open and communicate about how they feel about it.
Now,
And
if you don't have insurance, or
Mhm.
you can't find a specialized therapist like yourself, and you just can't get to one, do you have any techniques or suggestions for people for things they can do in moments of feeling triggered, in when they just get so exasperated, whether they don't feel well or they have to have now an arbitrary secondary smaller surgery, but they're scared to have to be put under? All these things are triggering. What can they do to just kind of diffuse the
Well,
situation?
and with most people that have anxiety or things of that nature, I always try to emphasize grounding techniques. And the grounding techniques are just something with all five of our senses. Um, Pick out three things that you can see and focus on them, something you can taste. And that might just be as simple as putting a mint in your mouth or a piece of gum or something that is a distraction. Um, Listen to the sounds around you, or put music on when you go to doctor's appointments or whatever it might be. And then sometimes just holding the hand of someone, or having something that makes you feel like calm. Sometimes kind of like a baby who would rub the
Silky blankie or
yeah,
something.
something like
Right.
that. And so things of that nature, just try to uh, ground yourself in those things. It kind of helps refocus. And you can find, like if you Google grounding techniques, there's a ton of them online that will give you some like list of suggestions, things of that nature. There are more starting to be more teletherapy out there, where you can find a therapist that will do more of like a Skype session with you, and they're at more of a reasonable rate too if you have to pay out of pocket. Uh, but a lot of times, if you've had multiple medical issues and things like that, uh, you might be surprised how many programs you might qualify for, and even insurance too. So there are more options out there. There are, I mean, I use the internet and a lot myself, just doing research, but trying to what they call now more mindfulness types of things, which is just more meditation, thinking positive thoughts, repeating positive phrases to yourself. And I always say, get a stack of index cards and write some positive things on there. And if you're feeling especially anxious, start reading some of those, because anxiety gets fueled off of negative thinking. So if you can kind of counteract that with some positive phrases until some of that feeling goes away, or that nervousness in your stomach, or just the overall shakiness, or what you might be feeling.
And when all else fails, if you can't go through the techniques of grounding, which, I mean, anybody who sees me rubbing like this, I'm usually trying to diffuse something. I'm just trying to, I might end up wiping off some of my eyebrow, but I mean, am I trying to diffuse something? But when I go into the hospital, if I have to have a colonoscopy, or I'm going to the ER, or I have to have a simple blood test or anything, I tell everybody I have PTSD, like it's a badge of honor, actually, because if I don't, they're not going to understand why I may jump off the table and end up on the floor. I mean, things have happened that I am not ashamed of anymore, but
you got to advocate for yourself.
Needles, alcohol swabs. Oh, and gosh, when I went into the hospital with TIAs, and they call it a stroke team, it's like 10 people come at you. Well, multiple people and lights it doesn't work for me. So as soon as I told them, they told everybody to back off. One voice, I had to focus on one person. And while it was scary, it was nowhere near as triggering. Everything became focused on one person. And so advocate, just tell everybody you have it. Just, it'll make it easier.
Medical staff, they get in there, they have a job to do, so they're busy focusing on that. But I think that they too could learn a lot, and be reminded of, especially with the aortic piece and the having surgery and emergency surgeries a lot of times, needing to be mindful that this is very anxiety provoking for people to come back and have to get multiple tests done and poked again and blood drawn and all that. And it's important, even though we feel like it's not our job to have to teach them or whatever, but a reminder, and you've got to advocate for yourself because you know what your triggers are.
Mm-hmm.
And if watching a needle or having the blood drawn or smelling that alcohol swab or what, you have to let them know.
Yeah.
And I think that makes it go even smoother because then you go in with a plan. And one of the ways of really managing anxiety is always having a plan in your mind.
Mm-hmm.
Okay, I'm going to go in there, I'm going to do X, Y, and Z, and then if that doesn't, then I have this backup plan.
Mm-hmm.
And then you feel like you have more control of the situation.
Yeah, I mean, CT scans are very anxiety provoking for most of the members in the community.
Mm-hmm.
It's, you know, everything from the IV, some of us have to be pre-medicated, it's the scan, the sound of the scan, and it's the wait for the result. So at the end of the day, that could be it too.
Yeah,
sometimes there's just nothing
mm-hmm.
we can do, and you just have to suck it up, buttercup, as they say, but there's ways to tell people to help you get through that.
Right.
So
right.
I'm going to take just a couple quick questions here.
Okay.
Somebody says, along with PTSD and anxiety, she's also heard of complicated grief disorder, which can stem from the PTSD from a traumatic loss of a loved one. This is true.
Yes, that is an actual diagnosis of grief disorder. And a lot of it is with the complicated grief disorder is also being stuck at a certain place in the whole grieving process. And a lot of times, if it was a traumatic death or an unexpected one, with the shock of that, it can take a little bit longer to get that process through. And sometimes you may need additional professional help to help talk that through and work that through for you. But that is very real. Yeah.
We did get a question, anonymous question, that came in that said, two questions. One, in the PTSD description, it talks about avoidance as far as discussing the event and etc.
Yeah.
This person's son is definitely doing this. He's 21 and just lost his dad, and he already had ADHD with anxiety, no medication because he's there's medical reasons he's not taking the meds. He's left his job and is just trying to recover at home, but his own health concerns are scaring him. Not sure what the best way to help somebody going through this extra type of anxiety would be. Do you just let them heal at their own pace, or are there suggestions of ways to handle that?
Well, the first thing there was
in the description of PTSD being avoidance.
Yeah, avoidance is the number one coping mechanism when you've had PTSD,
yeah,
because it's painful. But unfortunately, what really ends up happening a lot of times is the more we try to avoid it, the more it's still on our mind. We can't run from it. So for a little while, that may help someone cope in the initial reaction to it. But if this continues for quite a while, I'd say past 2 months, 3 months, try to encourage him to talk about it, express how you feel too. You miss him too, or it hurts me to think about him dying as well. And maybe in sharing how you feel might draw him out a little bit to talk about his experience. But some people are a little more harder to engage in that. And all you can really do is just encourage them to seek out help. You might offer, I'll go with you, or, you know, we can go together, or whatever may help. But ultimately, it comes down to that person having to decide they need to go get help, that we just can't force it, but we can gently encourage.
I think one of the worst type of events that happen that causes PTSD that I've seen about in the community is when doctors don't listen.
Mm-hmm.
When some of us have been telling our doctors they don't feel good, something's not right, and then months and months go by, and then all of a sudden they're like, yeah, you're right, you have this monster size aneurysm that we have to do surgery, or all of a sudden you end up dissecting, or it's the trauma of you've been put in an ambulance and you're taken to a hospital and they're trying to diagnose you with back pain, when the reality is you've had a dissection and now you lose a kidney because of it. So the common theme is that it's the doctors not really listening to us. So how does somebody move forward when the doctors are the ones that have to ultimately help us? And how do you learn to trust when a scan says you're okay or a doctor says you're going to be okay? And how do you begin to rebuild a relationship?
I mean, I think first it means really finding a physician that you can talk to and will talk with you, and not feel rushed and not take, you want somebody that's going to take the time to explain things, because so many times doctors can talk in medical terms that we just don't understand. But if it's somebody that really will take the time and really speak in layman's terms, basically, I think you have to research out those types of doctors and feel comfortable first with that medical person. A lot of times it's kind of reframing it in your mind. I have to decide to trust this information that I'm giving, because to do not trust, I keep myself in an anxious state all the time. It's really trying to find areas you can control. And some people may get caught up kind of in an obsessive compulsive thing, wanting one test after another to try to keep reassuring themselves that, no, I am fine right now. But a lot of it comes down to really having to make a decision to trust that healthcare professional that you've chosen for yourself. And if you're not happy with someone, you have all the right to go and search out someone else. Don't feel like you have to stay with someone because they were there at the time this event happened. You didn't have a lot of choices at that point, but you do now. And so I think that's a very important step first, is make sure you have an open communication line with your physician.
Okay, we're going to check and see if there's any other questions. If people have questions, now's the time you guys should.
Man, they called a SWAT team on somebody. That's horrible. That must have really been, oh my goodness.
Who that was, I'm not surprised. No, I'm kidding. So in addition, so just that you guys are aware, for some of you that don't know, and you probably do, but you feel free to tell people in other pages, we do have a grief page and a caregivers only page, which I have not seen anywhere yet on Facebook, what's related to aortic disease. So feel free to tell people about that. We do try our best to let people know, but and we are very specific in who we allow into those groups. So if you have a spouse and you want to refer them to the caregivers, let them know that they will have their space to disclose how they're feeling. And I take it on that topic, resentment is normal.
That's very normal.
Resentment, guilt. What are some of the other things that as survivors we should think that our caregivers might be feeling about us?
Well, as a caregiver, they didn't always, just like you didn't plan on having the medical condition, they didn't plan on you having a medical condition either. And just allowing them to vent and communicate that as well, but also being mindful of the adjustments they've had to make in their lifestyle as well. You may not be able to go out as often as you used to because you just don't have the stamina, or you're tired, and so they're adjusting that. They also live in some fear of something else happening too. So while you are the patient, they are the one that is also in it with you. So I think it's important that caregivers definitely find a support group for themselves. And there are, I know in our area here, caregiver support groups, and they either run independently or through the hospitals. But they need their own network as well. But also giving them a break sometimes, having some backup people that if they were always the one taking you to doctor's appointments or doing this or that, have like every now and then have somebody else do that too, to give them a break. But also, if they feel like it, if you're in counseling, invite them to come to a counseling session to see if there's anything they need to speak about too with you. And I can't stress enough the importance of open communication. A lot of caregivers feel like, well, they've been through enough. I don't want to unload how I'm feeling on them too, or whatever. But I think as patients and all that, you want to hear that. You want to hear and get them to share. So sometimes it may mean you drawing them out too, asking them questions. How's it been for you? What's this been like? What kind of change has this made for your life? What fears do you have? And really help them see that you want an open way of, let's work through this together. And because it is a lot, they make just as many changes as well.
Yeah, my husband, and I've told you this, has said before, you know what it's like to be chronically ill. You don't know what it's like to take care of someone who's chronically ill. And it was very difficult, complete total change of life in our home. And speaking of just in a home, children, I never share anything with my kid. He doesn't know if I go to the ER. He doesn't know anything. I figure if there's something he needs to know, he'll know. But mine's 20 and not in the house. For people that have children that are living in the home, it's hard to hide. It's hard to, how much do you share when you're not feeling well? How do you explain to them tonight's not a great night? Or, I mean, or my son's just so used to seeing me not feel well from years of having Crohn's disease. He's just impervious to it at this point. So how do people in the community with younger kids, how do you deal with that? How do you address it?
Well, I think that you have to take into consideration what age that child is and what they can handle. But children that grow up in a home where a parent has a chronic illness, they learn to adapt and cope with that in unique ways. And I think it is important just to let them know, today's not a good day, but we'll do it this day, or let's plan for, and, so that they don't have worries or fears. And a lot of kids they want to ask certain questions, but they're afraid to. So again, it's drawing them out. What are you afraid of? And they might say, I'm afraid that you're not going to be here for me. And then you can reassure them. None of us know that, but if I'm not, so-and-so will be, and you're not alone in this. And little kids need just reassurance of not being left abandoned, alone, that they have someone they can count on. And I think that's all they need, reassurance. But there's a whole different way of helping children adjust to chronic illness in the home. And there are people who specialize in counseling for chronic illnesses. And I think for children, it's important to get them involved in a counseling or a group setting where they can talk about that and be educated on how to handle the chronic illness. And there's a lot of kids that are dealing with a parent who, say, may have a chronic heart disease or diabetes, or just in and out of the hospital for certain things, or a parent who might have gotten in a bad car accident and can't work any longer. Just reassuring them that everybody is going to work together to make sure everything's okay for you, and that sort of thing,
Let me just check and see if there's any more questions, because I know Amy does have another client tonight. Okay. Had a really bad event in the hospital, and because of what happened, staff did not want to address the issues in a new area now. You just moved. Where's the best place to find someone to address issues? Yes.
As far as a counselor or medical staff?
I think counselor. I think, it sounds like he had a bad event in a hospital, and because of what happened, the staff didn't want to address the issues of what happened. So he's in a new area now. Like, where's the best place to find someone to address the issues he had? And he had some issues when he had his dissection. There was some issues with some, just some issues. So we'll just leave it at that, unless you decide to write in again and want to share it. He lost it after a large dose of steroids. Staff ignored, and later that night he did it. He did tell us that he escaped from the hospital.
Got out of
It's kind of an exciting story, Justin. You really should share it with everybody. So, but now moving to a new place, What's the best way to address this with doctors, or your fear of people not listening to you, or how they can best handle you moving
Well,
forward?
and that's from the get-go. I think you have to interview the doctor and say, this is what I need. This is what I'm looking for in a physician. Because if this is a chronic condition, you're going to be spending a lot of time with this physician, and you need to have a good working relationship. So I think it's important to interview the doctor in your own way. Go with your own preset questions, that sort of thing. Even if you're looking for a therapist to do counseling with, I think it's important. You can go to your insurance company and they certainly can give you a list of therapists, but when you're calling around, have questions that you're going to ask before you even make an appointment. How experienced is this person with trauma? What kind of techniques do they use? Do they use trauma-informed care? Do they use EMDR? Different techniques like that, and really screen out appropriate provider for you. And I find sometimes there are surgeons who really have compassionate care, and understanding. Other times surgeons, for example, just they get in there, they do what they're supposed to, and then they refer you back to your regular doctor. So if you're looking kind of to have that relationship with a surgeon, that might be shopping around a little bit more, but it might be your primary care doctor that really needs to be that go-between mouthpiece, and you need to know that you're comfortable with them, and they will coordinate the care and that sort of thing. So taking your preset written out questions, whatever, and don't just settle. Sometimes I think many times we all may feel like, well, they're all alike, or they're all this and that, but they're not. But you just got to do the search out for it.
And sometimes what is known as the best hospital isn't necessarily the best hospital, or the top doc might not be the top person for you. And exactly to what you just said, I won't see a doctor unless I can't get their personal cell or their email. And when I've interviewed doctors before because of different conditions, and I'll say, what is your turnaround time in getting back to me? Do you want email? Do you want a text? Do you want me to leave a voice message with a question? I need to have expectations, because I don't do well with, I need personal attention. I want it to be like a boutique, but I don't want to pay the boutique fee. But if I can't get it, then I'm just going to look for another doctor.
That's right.
I mean, my surgeon saved my life. I do have a little bit of that with him, but I definitely have that with my cardiologist. I mean, we're, very, very close.
And I think if doctors are in certain fields, like cardiology or what, they hopefully understand that
you need some hand-holding.
Yeah, and that, they need to be more accessible than some other physicians. But, I mean, I even give out my cell phone number, because I set the boundaries. I don't have any clients that are going to abuse that. We talk about that. What's the appropriate time to call, or that sort of thing. So
another person, she's getting ready to have minor surgery tomorrow and is feeling a lot of anxiety, more than the open heart. And I can totally relate. The very first procedure I had to have, I mean, when I had my colostomy and I was in the hospital, even prior to that, having some surgical repairs before I needed the big shebang, it is just, God, just walking in the room to get your blood test is stressful. If this is your first time back in since your open heart surgery, I mean, just as a fellow person, I can say, if you can handle your chest being cracked open, then anything else is a piece of cake. But how do you address that when I have to walk in the door? I'm walking in on my own 2 feet. I'm actually voluntarily going in right now for surgery. It's a crazy sensation.
And look for what you can control in that situation, for sure. And just run it through in your mind in steps. I'll go in the door. I'll sign in. I'll sit down, and kind of simplify it for you. But practice using deep breathing. I always like a technique that we use called a safe place, but it's just kind of visualization of something that you can think about, and it makes you feel calm and safe, and kind of just brings that blood pressure down and the nervousness. But you can tell yourself, I'm going to advocate for myself throughout this too. If I'm nervous about something, say it to them. If they're getting ready to draw your blood, let them know. I get triggered with needles, so bear with me or help me through this, and you do your deep breathing and things like that through each step of the whole process until you're done that day.
When I had to spend the night before and after a heart cath, and I brought a fan, I brought an eye mask, and I bought earplugs because I did not want to listen to the cardiac beeping on the
Yes,
floor, because that's where they put me to
yes.
monitor me.
That
And
beeping.
I knew I wasn't going to, I mean, first of all, it's hard to sleep. They come in all the time, but I decided I'm going to make it a little like home. I brought my pillow, and I just set myself up in a different type of environment.
Right. And if I don't know if you're going to be spending a night after your minor surgery, but if you do, yeah, take all of those things with you. The headphones, listen to your own type of music, because there are so many sounds that can be triggering and that sort of thing, just to try to keep you in that zone of your own. That
can also ask for a little Versed before they start your minor surgery, and just to like pop that edge off, because it's really good. It works really well too if they're willing to give it to you.
That's true.
So we are at almost 10 up. I know you have somebody to see.
I do.
Save the world. One brain
That's
at a time,
right?
So if you have any other questions, please feel free to type them in the comments. This video will stay up. It's going to be posted to our website. Amy will go ahead and she has access to take a look at it, and we'll answer them directly for you. And we're going to work out a time where she might pop on to one of our private support group meetings, which we will be having our next one on the 30th of this month. So Thursday night on the 30th, we'll be having our support group meeting. Everybody's welcome. And yeah.
Well, thank you so much.
Thank you so much. It's always so great.
I enjoy it. I do.
See you twice this week. It's good. Now I'm going to go home and get ready for bed soon, because now I'm tired. But
now you're all worn out.
I'm worn out. I'm tired. I really am. All right. Thank you, everybody, so much. Thank you. We will talk to you soon. Take care. Bye-bye.